Well, hello everybody, and welcome to the Barking, Havering and Redbridge University NHS Trust Annual General Meeting. My name's Jackie Smith and I'm the Chair in Common of BHRUT and Barts Health. And this AGM is an opportunity to reflect on our achievements and our challenges over the last year and to think about our plans for the future. And we'll be hearing after my introduction from Matthew Trainer, the CEO of BHRUT, from Shane DeGaris, the Group CEO of Barts and BHRUT, and from Nick Swift, the Chief Finance Officer. And then there'll be the opportunity for anybody who would like to ask questions, and you can simply raise your hand and I will see you in the chat if you want to do that. So this has been a really important year for the NHS and also for our trust. This year, of course, we celebrated the 75th anniversary of the NHS, providing us with the opportunity to reflect on how much has changed in the way that we deliver care for our patients, particularly in our use of digital innovation. At one of the many events we hosted at BHRUT to thank our staff and communities and to celebrate that 75th birthday, I hosted a panel discussion on what the NHS will look like at 100. It was very insightful to hear the range of views. The basis on which we organise and pay for our NHS, funded by taxation and free at the point of use, maintains high public support, but that doesn't mean that we can stand still. Providing quicker and better access for our patients to our services, using technology to better support patient care, introducing innovation and the fruits of research, and organising our services around our patients, not our institutions, all need us to continually challenge ourselves to change and improve. And we've been doing that in this year, as you'll hear. But it's been tough as well. Good health services are an economic policy, as we've seen from the numbers of people unable to work due to chronic sickness or waiting for procedures. And tough economic times impact on us as a provider of healthcare as well. We're managing in times of pay restraints and workforce shortages on top of a cost of living crisis. Not only is this making it more challenging for us to effectively run services, it's also further increasing health inequalities in our communities. And of course, we're still living with the impact of the pandemic. Some of us are literally still living with COVID. We're continuing, therefore, to have to innovate to tackle the waiting lists, which grew longer during the pandemic. With initiatives like launching the UK's first robotic colonoscopy service through to our dedicated elective surgical hub at King George Hospital, which has been shortlisted for 2 Health Service Journal awards. You'll hear more about those and other initiatives, including our Community Diagnostics Centre at Barking Community Hospital, which is helping to reduce health inequalities and to promote access in the borough, from Matthew later. The need for innovation to meet the needs of our patients in a time of ever-increasing costs is more important than ever if we're to deliver high-quality, equitable care to our patients. And recent developments at our hospitals include being the first trust in the country to introduce the Nuna app for our cancer patients. This allows them to instantly message our team with questions or concerns and to see all the information relating to their treatment in one place. And the app also helps to improve safety by tracking the urgency of messages and raising alerts. Our stroke team has undertaken pioneering work with GPs for patients who suffer from atrial fibrillation, irregular heartbeat. Our highest risk patients are identified and asked to download an app which enables them to monitor their heartbeat. The information is sent to the team in a virtual AF hub who decide on the best course of action. Patients without a smartphone are offered a face-to-face checkup, which helps to level up health inequalities. And this project was recognised in Parliament and has also been shortlisted in the HSJ Patient Safety Awards. And we've launched the world's first digital surgery in partnership with Surgery Hero, giving structured support to patients accessible from their own home to support them in preparation for having surgery. It includes a one-to-one coach, a personalised wellness programme, peer support groups and access to helpful metrics like sleep tracking. And we've already found that patients who use the clinic are much more likely to arrive for their operations in a fit for surgery condition, which reduces the risk of complications and speeds up their recovery. We're also helped by our collaborative partnership with Barts Health. That joined up working, which builds on the mutual aid that each hospital already offers to others across the patch, is helping to reduce waiting time for routine operations in key surgical specialties. And through collaborative programmes like REACH, which stands for Remote Emergency Access Coordination Hub, we've been able to reduce unnecessary hospital visits by giving paramedics direct access to expert advice from emergency clinicians. And we're really making a positive difference in the quality of care we're able to offer to our patients. Another important development, which is also helped by our collaboration with Barts Health, is the very good news that we got last week when we were able to confirm that we will be introducing an electronic patient record here at BHRUT. As the last acute trust in London to have an EPR, this is something that has been long awaited and which will have huge benefits for patient safety, patient experience and our staff. The EPR represents £44 million of investment in the trust, and it will be operational in 2 years' time, provided by Oracle Cerner. So we'll have the same version as the one at Barts, meaning that if you visit any one of the 7 hospitals run by this trust and Barts Health, your records will be accessible to all clinical teams working across those sites. That's a really exciting step forward for the trust, and it will improve outcomes and experience for our residents and for our staff. And talking about our staff, of course, to truly meet the needs of our patients, we have to look after all the people who work with us. This year, we've embedded a range of wellbeing initiatives, including ongoing cost of living support, such as our marketplaces for school uniforms and office wear, as well as providing free period products and giving staff access to a proportion of their salary in advance of payday. And we use those NHS 75 celebrations I talked about to celebrate and thank our staff and communities. So as part of that, we held over 10 events. We had 600 children, for example, joining our 2 education and careers fairs, where we were able to tell them about work opportunities at our trust. And they also got to meet some of our staff who were hosting a really interesting interactive stalls showing how the NHS has changed in 75 years, providing opportunities for children in our local communities to learn and to work in our trust is really important to us. And 5,200 staff members and their families joined us for breakfast, brunch, afternoon tea, an evening party, and a family fun day. And in many of those events, they were able to benefit from our very own headline band called the Pfizer Chiefs. And the Pfizer Chiefs are continuing to be asked to play elsewhere in the health system as well, raising really important funds for our charity. So in closing, I'd just like to thank people. I'd like to thank our staff, our patient partners and volunteers, King George and Queen's Charity, and all those working alongside us across North East London, and to my hardworking board colleagues. Thank you. We're going to formally adopt the annual report and quality account, and I'm going to pass over to Matthew to talk more about the last year. Thank you.
Thank you, Chair. I think with some slides, I'll just check. Can someone give me a thumbs up if you can see them and hear me clearly? Thank you very much. Okay, so I'll cover through this, which will be familiar to people who've been at our board over the year, but I'll pull out some of the key points. So we've been focusing hard within the organisation on making sure that we've got the right people in senior leadership roles and the right structures in place to manage the pressures in our organisation. I know that this can sometimes sound as if it's slightly distant from patient care, but the enablers of good quality patient care are strong leadership and a strong sense of accountability within hospitals like ours, where we know who's responsible for patient flow, making sure people get the right care and the right services at the right time. And I'm pleased that in the last 6 to 12 months or so, we've really seen a step change in our ability to get the clarity in structures and also to bring some really high quality appointments into the organisation, as well as recognising and promoting some of the fantastic talent we have here at BHRUT. Particular shout out to the team at King George, who were fully established earlier this year and have started to get some real traction there. And we were recently joined last week by our new medical director at Queen's Hospital, which completes the recruitment here. So that's been really helpful for us in terms of starting to really bring some of the things we're trying to change to life. We're also in the process of working through our organisational strategy. The Trust hasn't had one for a number of years. And we've spent some of this summer understanding from our staff what they see as the real purpose of our organisation, engaging with them about what it's like to work here at BHRUT. And over the course of the autumn, we'll be working with many more of our stakeholders across our local place structures and other partner healthcare organisations to bring that to life. The chair's already mentioned the electronic patient record, really exciting piece of work, £44 million investment in the electronic patient record, and additionally more than £11 million investment in better quality Wi-Fi for the 2 hospital sites, the 2 main acute hospitals, to make sure that we have the infrastructure to enable this to work. It's great for staff, it's great for patient safety actually and patient experience, with that joined up ability to look across our hospitals in North East London and see what's been said and done at different hospitals within the patch. And also really importantly, a fruit of our collaboration with BARTS. You'll hear more about that later from Shane DeGaris, who's our Group Chief Executive Officer, but this is the kind of work that we can't do without the kind of BARTS infrastructure and the kind of thing that's always best done in collaboration for the benefit of patients and staff. We've had a big focus this year on supporting and thanking our staff as well. It was the 75th birthday of the NHS earlier this year, and as a result, we invited and saw more than 5,500 of our 8,000 staff attend thank you events over the course of 4 or 5 days. This was everything from an evening do, which has already been mentioned and went down very well, to a series of lunch events, tea events, bringing in more than 600 children from local schools to look at careers in the NHS and to see what the Trust does, and a fantastic family fun day that allowed for some of our staff a chance to take their children out for a day with the Trust footing the bill in a context where the cost of living is making life really difficult for many of our employees. And that cost of living support has been a real theme this year. Just recently with our second school uniform workshop, where we created a marketplace to provide people with free school uniform going into the start of the year. And there's been a range of initiatives over the year where, although we can't locally determine pay structures, which are nationally determined, what we can do is other things to try to put money back into people's pockets, and things like the school uniform work, free period products for the women who work here, a range of these different interventions where we can try to help people facing the increasing cost of living. In a bid to try to open up our senior thinking to some different perspectives, we've been running a shadow executive since the start of the year. We're now into our second cohort, but this is 12 members of staff who get full access to all the exec team papers, discuss them, and bring a different eye to the decision-making process. They're predominantly clinical staff, predominantly people who are newer to the NHS and more junior in their career. And what they're doing is offering us a much more representative perspective on the kind of business that comes to Trust Exec, and actually bringing together the views of our established, experienced executives and the shadow executives has been really powerful. And it's also great to see that the more that we open up the workings of the organisation to people, the more that many of our staff have recognised that the work that does consume the time of the shadow of the executive team and the board, in fact, is very much work that speaks to the pressures that are being faced by frontline clinical staff. And I think actually it's been reassuring for many of them to see that the things we're worried about aren't esoteric and distant from their day-to-day experience of working in the NHS. And we'll be continuing to do that next year. And also within our organisational strategy, building up that representative group to make sure that the strategy we develop for a trust like ours is one that very much reflects the places in which we live, work and deliver care. We've got, as every trust has in the country, some really specific characteristics to the places we're in. And actually, it's really important that our organisational strategy recognises the challenges that brings, but also speaks to the fantastic strengths that that diversity brings to BHRUT. Next slide, please, Carly. We're living as ever, though, within the NHS, but particularly this year within some really tough financial challenges. You can see this reflected in our annual report and accounts, but we're in a position where demand on our services and the cost of running our services is growing beyond the rate at which we're funded. And that means we've always got to keep an eye on where we're wasting money and reduce that waste, and also look for other opportunities to improve the way in which we spend money in a more productive and efficient way. But it does mean that as a trust, we're repeatedly living beyond our means. That's putting pressure on our financial envelope. So the staff are experiencing cost of living pressures, the trust's in a cost of living environment where inflation is high. And we've also, in this financial year, got the strikes to deal with as well, and that'll be reflected in our next annual report. That does, though, mean spending less on very high cost bank and agency staff. And you can see here in our annual report and accounts that we made some significant inroads there. And then also putting plans in place to really look at other areas of waste. Our key priority is to try to avoid doing things that reduce our ability to provide good quality care and effective services, and to make this a good place to work for staff. But we're balancing off many different pressures at the minute. You can see in the annual report and account that those financial challenges feel very real. And actually what you'll see in 23-24 in due course is that that theme has continued, and indeed the envelope is getting ever tighter as we move forward. Next slide, please, Carly. We've been doing a lot of work on transforming urgent emergency care, and the system is under lots and lots of pressure. Last winter, I think, for many people in the NHS was one of the toughest they'd ever seen. What's interesting is we're in the middle of September in a heat wave, and that pressure is continuing actually right across London and actually nationally on urgent emergency care. What we've been focusing on within Queen's and King George is building up same-day emergency care, so that allows people to be treated and seen by the right specialties without an overnight stay that could perhaps be avoided. About building new discharge facilities, which we've now got in place at Queen's and King George Hospital to help people get home earlier in the day and create capacity to move people out of the emergency department. And what we've seen is a 20% improvement in our Type 1 performance. So that's our majors performance in A&E since February. That's taken us off the very bottom nationally and out the bottom 10% of trust, but we've still got a long way to go, with many patients still waiting far too long in our services. But lots of this being achieved through fantastic hard work of our emergency department staff, working in partnership within the hospital with our specialties, whether that's in medicine, surgery, acute medicine or operations, but also partnership working more broadly with the company PELC that runs our urgent treatment centre, with North East London Foundation Trust, who run our mental health and community services, and of course with local primary care, who are seeing more patients than they ever did, offering more appointments than before the pandemic, but still at times are overwhelmed with demand. And it's really important that we work out there with primary care and other community partners to try to improve this into the future. So there's been some positive signs with urgent emergency care in the course of the year 22-23. You'll see that reflected as we continue into this year, but there will still remain a theme because it's an area of the NHS. It's one of the last unrationed elements of care, and it's where, as societal economic pressures, etc., build up, it's where people turn up looking for help. So thanks to everyone who's working tremendously hard on this, but will continue to be a theme of concern for us while we recognise the progress made. And some great work on reducing waiting lists. We're one of only 3 trusts in London who eliminated 78 weeks, that's 18-month waiters, by the end of March, which was the government's goal. We've seen significant innovation and capital investment in surgery, a new elective surgical hub, which is being built at King George Hospital, and which will be opening shortly, community diagnostics centre at Barking Hospital, and some new diagnostics facilities at St George's Community Hospital opening next year. Super clinics to really focus on treating people who are there waiting in the backlog, whether that's for first assessment, diagnostic or treatment, and some real state-of-the-art equipment that the chair has already mentioned, which is bringing together the very best of our people and the talent and skills they have, making sure they've got great equipment and they're working in fantastic environments, supported by operations and administration staff who make sure that their waiting lists and their clinics run like clockwork so patients get the care they need. What you will see in next year's annual report is that that exit position from 2023 was then hit by the strike action. That's not covered in the period that this annual report covers, but it's fair to say that that considerable progress that we made to the end of March has been hit by the strikes. But more on that in the course of next year. But that shouldn't take away from the fact that our planned care teams and our surgical teams, diagnostics and others have really done some quite wonderful work to get us into a much stronger position. So that's a quick overview of what's been a very busy and challenging 12 months with lots of positive progress to report, but still some really significant operational, quality and financial challenges for the leadership team to deal with here at Queen's and King George. But we just thought now that we'd give you a bit of a flavour of some of the thank yous that we've been saying to our staff, because we really couldn't do this without them. So I'll hand over now with fingers crossed for audio and visuals to a brief video clip. Thank you. At BHRUT, we like to do things a little bit differently. That's what's behind our staff thank you events, where we give something back to our staff to show how much we value the contribution they make. Lots of our staff live locally, and they've either grown up here through the generations or they've come here from overseas and made it their home. It's really something that makes this trust a very special place to work.
We are a trust that sits in North East London, one of the areas of the UK that is the most deprived, where we are tackling real health inequalities.
It's a challenging place to work sometimes because it's very busy and, you know, we do serve a high-risk population, but that also makes it a fantastic place to work because you can really feel the difference that you make on a day-to-day basis when you come into work.
Within our role, we do sometimes see such sadness and heartbreak, and to be a team and to look after our patients, we change their lives basically.
BHR is like a real community, and it's a hard hospital to work in. It's really, really busy. However, the staff really care about each other and they're really passionate about what they do for their patients, and that really just comes out in the care.
It's very inclusive and there's no barriers, you know, so everyone's included, everyone's opinions sought after.
The thing that BHRUT offers is the amazing diversity of population that we serve and also of staff who work at the trust. That sense of local community and actual local pride in what we're doing and what we're trying to achieve.
The hospital is really diverse, so it's not only from the Philippines, it's every, like India or any part of the world, we are already here, and because of that they are helping us to adapt to the country, give us an opportunities.
I came to this country in 2000 and I've worked for this trust ever since. So I love working where I am.
I would recommend here for someone starting in the UK especially, because after working here you can work anywhere in the UK because you will see varieties of cases in different specialties. So you gain so much experience and confidence in the job.
You have opportunity to be trained, to be mentored, to be coached by leaders, by people, by whatever specialty you want to develop in. And it's not a lecturer way where you learn from a book. It's actually learning on experience and being supported by your peers.
It's such a fantastic opportunity to work here at BHRUT. I've worked across quite a few trusts in London. The diversity of the people I work with, the diversity of the clinical conditions that you see, and it's just the sheer reward of coming to work and being thanked for the work that we're doing with this fantastic patient group that we're working with. Just feels really rewarding.
We're a pretty small team, but we are all very close, and that makes it really nice to work together.
Yeah. You can walk onto any ward and the welcome that you get in it on a ward, it's just, I really love it. I just think it's a really lovely atmosphere throughout the hospital.
Well, I've been here over 33 years. I've retired and have since been back since 6 years. So that is something.
It's my first trust, and I think I'm gonna be staying here. I'm really, it's really fun.
So we're looking for fantastic healthcare professionals, people who really do want to do their best work, progress their careers, people who have energy and excitement and are looking to really make a difference.
Thank you, Matthew, and thank you for that great video as well, which really does showcase the enormous energy and passion and commitment of our staff. We're now going to move on to Shane DeGaris, who's going to talk about the work that we do alongside our partners across North East London. Thank you, Shane.
Thank you, Chair, and good afternoon, everyone. First slide, please, Mark. So, look, we've really continued to work hard as partners across acute hospitals, and all this really was borne out during the pandemic, and that has continued throughout 22-23. And the partnerships aim to reduce those inequalities of access, to improve outcomes, and increasingly building on mutual aid between our hospital systems and to improve value for the taxpayer. So in the last year, we've taken forward a number of clinically led initiatives and trying to focus on a balance between what can be implemented quickly in terms of quick wins and what is better for longer term sustainability for both organisations. Next slide, please. So we've been increasingly working as an integrated group of 7 hospitals, mostly working with Barts Health, and very much trying to design strategy, culture, and leadership. And you can see a list of enablers there that we've tried to focus on that are common to both of us. So the use of temporary staff is a great example. Workforce challenges exist right across the NHS, and working out how we can work better to collaborate has been a big impact. And Jackie's already mentioned the digital collaboration in terms of electronic patient record. And there's clearly a lot we can do here by working together to do things once to improve quality, safety, and as I said before, to sort of taxpayer value. Next slide, please. So we've put up just a couple of examples on the screen here, which I thought might be helpful. So the firstly is the REACH expansion. So that's the Remote Emergency Access Coordination Hub, run out of the Royal London and then rolled across to Barking Havering and Redbridge, and essentially providing patients with the option and support from the London Ambulance Service to avoid the need to attend a busy A&E department. And this has been a hugely successful endeavour, and one we want to build on further as time moves forward. We also held the first joint revision knee surgery case to help a patient who'd been waiting for surgery get their treatment much sooner. And as Matthew referenced earlier, building on the great work across at BHRUT around the plan of care, surgery, waiting lists, working together with other hospitals across Barts to improve access for all of our patients across North East London, regardless of where they live. But also focusing at a place-based level, so trying to, again, prevent the need to admit patients to hospital if they really need to. We had the Best Bed is My Bed event in July and agreed priority actions with our place partners to reduce those admissions, and continue to work with partners across Redbridge around early detection and primary prevention for cardiometabolic comorbidities. And again, a focus there to reduce barriers, particularly on hard to reach communities, and again, prevent those unnecessary admissions to hospitals. So there's been a lot going on in the clinical and non-clinical collaboration space, which we want to build on. And just on the last slide, please. And I just wanted to finish with a kind of a broader note of, whilst Barts and BHRUT is the prime source of our collaboration, we also work with a number of other partners. So with the Homerton University Hospital, through our acute provider collaborative, increasingly looking again to give patients access to services and reduce those health inequalities right across North East London, but a whole range of other partnerships too. You can see everything from the Integrated Care Board itself, local governments, and our place-based partnerships, university partners, of course, central to growing the future workforce, training, developing and retaining them, and of course the support from our charity at King George's and Queen's. So a lot going on in the collaboration space, and I suspect you'll see each of these annual general meetings. We'll talk more and more about how those collaborations are expanding across the various areas, but also with some really tangible benefits to patients and staff as part of that. Thank you, Chair.
Thank you, Shane, for that. Now we're going to move on to Nick to report on the financial situation over the last year. Thank you, Nick.
Thank you, Chair. Good afternoon, everyone. 3 brief slides from me, please. Last financial year, we did meet our targets, which was excellent. And this slide just summarises some of the things we did to get us to that position. So thank you, everyone, for that. Next slide, please. And we're really pleased that the amount of support we are receiving for longer term investment, both in estates and digital, and that's crucial given projected demand. And then finally, please, in the near term, there is a lot of pressure, as you've heard. I think we should be very grateful for the way the exec team is getting behind the programme. We can't all sing, but we can all count, and having a collective approach to making sure that we're spending the money we've got for the best benefit of our patients is really appreciated. Thank you very much.
Thank you, Nick. So, as I suggested at the beginning, now is an opportunity for any members of the public who would like to ask questions. If you want to ask a question, if you use the hand function on your Teams, I will see you and I can bring you in at that point. We haven't got any at the moment, but I'll just give another 30 seconds or so for those people struggling to find the hands, if there are any. Okay, good. Well, I will take no questions as a sign of the quality of the presentations. Thank you, everybody, for attending the annual general meeting today, and thank you in particular for all of your efforts over the last year, which is what, of course, we are reporting on today. Good. I will bring this year's annual general meeting to a conclusion then, and thank you very much for your time.